Thank you, Mr. Chairman, and thank all of you for being here. And thank you especially for your personal stories. They have been very inspirational. And Mr. McGee, I'll start with you. I really do appreciate your stories and especially appreciate your work with NAMI. What a great group. I worked with them when I was in the state legislature, and I continue to work with them here, and they truly do some great work, and I appreciate that. I wanted to ask you, from your perspective, after all you've been through, integrated care could change a patient's trajectory. Do you believe that?
Absolutely.
And obviously you've given an example where you thought in your particular situation where it could have. I'm a pharmacist professionally, and I practiced pharmacy for over 30 years, and I have been wringing my mind trying to think how I can incorporate my experiences into this. And you know, having tools in our toolbox is very important. And I'm just thinking along the lines that if I had the opportunity to know that someone had a history of substance use disorder, that would help me in my practice. It would help me help my patients. And that's what pharmacists want to do. They want to serve their patients and help them. And I'm just thinking, I'm just trying to figure out what would be the downside of this. I mean, you know, I've had the opportunity to be at a number of different conferences and to speak on substance abuse. In fact, one of those conferences was down in Atlanta, the prescription drug abuse and heroin conference that Representative Hal Rogers sponsors every year, and I've had an opportunity. And one of the things we talk about at that conference is the stigma, and that is a big problem we have to get over, particularly when we're talking about the opioid addiction. You know, I suspect, and one of the things we talked about at that conference in particular was that we say there's 115 people dying every day because of opioid abuse or opioid addiction. It's probably a lot higher than that. You look in obituaries and papers and you'll see it was a sudden illness or it was even suicide. And there are families and individuals who would rather say that it was a sudden illness or suicide than to say it was substance use disorder. And just, you know, if I could go to Mr. Gardner and just ask you, I know you mentioned earlier about all these forms you had to fill out and in the sense that it just stigmatized you, made you feel. Can you just elaborate on that? What your feelings were with that?
Well, when I went to treatment myself 12 years ago, before I went, and I'm just one person, so again, I'm not speaking for all patients, but I called my boss. I called 3 or 4 people that I figured needed to know before I went. Wasn't sure how I could keep that secret in the first place, to be quite honest with you. And I had no assumption necessarily. Of course, I had some embarrassment or shame or frustration mainly about why I couldn't get this under control myself, but I didn't have an assumption that I needed to keep getting healthy or better or getting help a secret. I really, truly, genuinely believe that notion was introduced to me in some way by the consent process.
Right.
But not just the consent process. I don't want to oversimplify it. Stigma is a much bigger, broader thing, and I just think this overall paradigm of secrecy and separating this particular illness from the rest of healthcare over time is stigmatizing. I mean, I think the healthcare, can I say one more thing?
Sure.
The healthcare industry is one of the places where this has been neglected and the most in the past. And so I think things are changing for the better. Healthcare is at the table now. Really, I mean, you know, here in the halls of Congress, how much attitudes have changed drastically in the last 5 years, 10 years, and in healthcare. So, for example, I think if we want to have, as I do, substance use curriculum in medical schools as a part of becoming a doctor.
Absolutely.
Which I think is paramount. I think we need to open these highways to integration and get healthcare.
So, in other words, it's time to pull the drapes back. It's time to open it up, and you know, and I'm not just talking about patients. It's time for us in society to recognize. And you know, we talked about NAMI. It's time for us to recognize that these are truly diseases here. That you know, this is not something someone chooses. in a lot of cases. This is something that needs medical treatment. I have not, during this testimony today, found one reason why I don't support this legislation. I have just simply not. I want to thank the author of the bill for bringing this forward. This is something it's time for us to get through the 70s and get into 2018. So thank you for bringing this forward. And thank all of you again for being here and for your testimony and your work. I yield back, Mr.